Hello, my name is Isabella Zubrod, and I did my senior preceptorship at Providence St. Peter's IMCU cardiac floor. My capstone is on nursing care of a post-coronary artery bypass graft patient in a progressive cardiac care unit. If you hear me say post-CABG, I am referring to the shortening of post-coronary artery bypass graft surgery. What prompted my interest in this topic is in my unit that I was precepting in, we would get all post-CABG patients once they were transferred down from the ICU, in which they typically stay in the ICU for about 24 hours to be monitored post-surgery. I became really interested in this population of patients due to the nature of their surgery. They come down to our floor with graft sites either on their arm or leg, a midline incision on their thoracic wall, chest tubes, and pacing wires as well. I learned how to take care of their sites and drains, along with educating them on life after CABG surgery. In my quest of a lifelong learner, I wanted to continue to research on nursing care of this population and in turn better care for them. What surprised me when I first came into this unit was the requirement of 4 walks a day. Some of our patients were less than 24 hours post-surgery, and looking at them with all their lines and drains and incision marks, you would think they would need to be in bed rest for a couple days. In fact, getting them walking 4 times a day decreases post-surgery complications such as respiratory complications, and it decreases the length of stay and an increase in positive outcomes for this population. Getting them up and moving early is a big nursing and consideration for this population. Education on sternal precautions and pain management can help them get moving. While researching, I was reading a lot of articles that was reinforcing the practices I did on the unit. Controlling acute pain was a big thing I read for this population. They are coming from essentially an open heart surgery. Their heart is being exposed to the outside world. Moderate to severe pain is something this population will face. Education on pain management and fears of taking opioids and physical activity is something that was reinforced over and over again. There is a significant relationship between pain and functional status. Managing pain can lead to positive outcomes in this group. During my practice at the IMCU unit, I saw the strict adherence to walking and pain management. The unit did an excellent job educating the patients on what to expect during their time in our unit and what to expect after discharge. I would walk into rooms and the patients were on top of their walks and ready for their pain meds. Both patient and nurse worked as a team. In our unit, we also implemented sternal precautions due to the sternum incision. This has been shown to reduce stress on the site and control pain for them to be able to walk around. There are 3 things I want you guys to take away when working with post-CABG patients. The first being managing pain. Nursing care needs to be focused on alleviating fears of opioid use and pain itself. Education is a vital necessity in this population. The second thing I want you guys to take away is the need for physical activity after surgery. With proper pain management and sternal precautions, patients can get their walks in. It is our job to motivate and get them to a place where they're able to do so. The final takeaway is due to the nature of this surgery, these patients are coming in with severe coronary artery disease, or CAD for short. So they essentially have a blocked artery in their heart, which prompts the surgery. The surgery reestablished this blood flow, but it's not a cure for the underlying disease process of CAD itself. Nurses need to educate on the importance of slowing down this progression, and that is through lifestyle changes such as following a cardiac diet, getting into cardiac rehab, and becoming more physically active. Other stressors include reducing stress factors and quitting smoking. This will improve the decrease of the progression of CAD. We have to look at the whole picture in a holistic light with this population. If we're able to, we can work together to prevent them relapsing into another blockage and improve their life outcomes overall. Thank you for listening to my capstone. I am really enthusiastic about the care for this population. I want to thank my preceptor, Mackenzie Gear, and the whole St. Peter's IMCU unit staff. They have provided me with the opportunity to care for these cardiac patients and piqued my interest in cardiac nursing. I want to thank my family who has supported me through this journey of nursing school. And finally, thank you to my peers and professors who have guided me to the nurse I am today.